Hi, my name is Vivek Iyer. I'm one of the cardiologists here at Marin Health, and I'm one of the cardiac electrophysiologists, which is a heart rhythm specialist. In this field, we deal with all kinds of heart rhythm abnormalities, including when your heart goes too slowly or when it goes too fast. And today on this week's episode of All Heart, we're talking about atrial fibrillation, which is the most common heart rhythm abnormality. What is atrial fibrillation? Well, it is a condition when the top chamber of the heart, or the atria, are beating way too fast. In the condition atrial fibrillation, the top chamber of the heart is going at 400 beats a minute sometimes. And at that fast activation rate, the heart is really just quivering. It's not really moving blood very much. And so we encounter two problems really with atrial fibrillation. Number one is the fact that blood can stagnate and cause clot formation and strokes. And the other problem, when your heart is racing that much, you tend to feel it in your chest. And some people feel it as palpitations or a fluttering in your chest. Other people feel it as just not feeling right or not having enough energy to get through the day. And so thankfully in our field, we've developed a lot of options for treating this. In one option, we try to use medications, both to manage the stroke risk that comes with atrial fibrillation, and also to try to control the rhythm so it doesn't get in the way of your everyday life. The other option is a technology-assisted option, and it involves a procedure called a catheter ablation. And today we're going to guide you through the electrophysiology lab and show you a little bit more about the technology and the procedure. We have here a patient that's undergoing an atrial fibrillation catheter ablation procedure. Now, before the procedure even started and the patient's asleep, we're able to use something called echocardiography, which uses ultrasound waves to look in the heart and make sure there's no clot or any pre-existing condition in there that would preclude us from safely doing the procedure. This is a minimally invasive procedure. So what we mean by that is that there's no cutting really in this procedure. We don't use a scalpel to go through the chest. Actually, the entirety of the procedure is done through tiny needle pokes in the groin. By simply following the blood flow from the leg all the way into the heart, we're able to position various catheters into the heart to both record from the heart and also do the important work of treating the abnormal areas. Now, one of the first things that we do in this procedure is mapping. We want a good idea of what the heart looks like and where the pulmonary veins are, which drain the blood from the lungs into the heart. These are going to be the primary areas where atrial fibrillation originates from and the areas that we need to treat. And so thankfully, we're able to use a variety of technology to localize where the pulmonary veins are and make our map. So you'll see in the screen now that we're also able to use X-ray technology, which is an older form of technology. Thankfully, we use very little X-ray in procedures nowadays with very little radiation exposure, but we can use it just to see where our catheters are. Now, as I move the catheter around on the inside lining of the patient's heart, you'll see that these squiggly lines or electrical signals are being collected in real time. We can analyze these electrical signals to find out exactly where we need to treat and whether we've achieved our objectives of cauterizing the necessary tissue. Now here you can see me articulating the catheter inside the patient's heart in real time. And by doing that with my hands down here at the leg level, actually the tip of the catheter, which is located in the heart, is able to move from point to point. And we can get exquisite control of the tip of the catheter and also be able to get this tactile feedback of the catheter against the heart tissue. The technology has come a long way, so in addition to my tactile feedback, I'm also getting a visual readout of exactly the number of grams of force I'm applying to the tissue. Marin Health has invested significant resources into the technology required to do these procedures safely and effectively. The success rates of catheter ablation now are upwards of 90% for early stage atrial fibrillation, presenting it as a really attractive option for patients early in the disease process. We are on the cusp of new technologies that are going to be released for ablation in the future. For example, pulsed field ablation technology is a new technology under investigation. We're optimistic that pulsed field ablation will become the standard of care for future ablation technology, and we're privileged to be able to offer it in the context of clinical trials to our patients.